So how many of you have suffered from a terrible headache that kept you going from pursuing your day? Well, today I'm going to tell you more about this piercing pain. And by the end of this speech, you will know how to deal with it. Headaches and migraines are very common. Everyone has had at least one headache throughout his or her life, due to stress and other factors. Teenagers and college students are more prone to these headaches and migraines. I have done extensive research on this topic, both online and in-person interview. I interviewed my cool pharmacist. Migraines can affect just about anyone, and they are a lot more serious than just a simple headache. And not a lot of people realize that or know that. In this speech, I will first explain what a migraine is, and then I will talk about what causes it, and lastly, I will mention what can be done to prevent it and treat this pain. So, what exactly is a headache and a migraine, some of you might ask? According to an article I read by Goatsby and Ferrari, a migraine is a chronic neurovascular disorder. It's characterized by episodes of severe head pain that is often throbbing and frequently unilateral. These episodic attacks can last up to anywhere from 4 to 72 hours. As listed on a fact sheet on womenshealth.gov, there are many different types of migraines, but the most forms seen often are a migraine with aura and a migraine without aura. And a migraine without aura may include symptoms such as nausea, vomiting, yawning, low blood pressure, and sensitivity to light, sound, or motion. A migraine with aura can include those two, along with some of other more serious symptoms, which include blind spots, seeing zigzag patterns, or flashing lights, and hallucinations. Yeah, it's that bad. Now that we have a better understanding of what a migraine is and what the pain feels like, let's change it up a little bit and start talking about what causes it. So, according to the Science and Technology article that I read, the widely accepted explanation is that the initial cause of migraines is due to blood vessels in the head, and these blood vessels have nerves wrapped all around them. As they dilate, these nerves become stretched, which causes the pain. As further research shows, that narrowing of blood vessels causes a reduction of blood flow to the brain and surrounding tissue. Recent brain imaging studies suggest that these migraines are neurological disorders rather than circulatory ones. The pain associated with a migraine is actually due to the brain's misinterpretation of signals from elsewhere. Those suffering from migraines have a problem processing normal stimuli, such as light, sound, and probably pain signals too. There are many triggers that bring on migraines, both internal and external. Migraines are an issue that cannot or should not be ignored. They can disturb your daily routine in life. Although there isn't a cure for migraines, there are many things and techniques to help someone avoid and treat a migraine. Food is a common trigger. Therefore, it isn't a good idea to keep a diary of what you eat in order to narrow down what foods are causing the headaches. And also, avoid skipping meals, the most important thing. You should also limit your caffeine consumptions, which is so hard to do for me, to less than 2 caffeine-containing beverages a day. Exercising daily. Exercise daily can improve the quality of your sleep, and it can reduce stress. If the migraines become serious and interrupt your daily activities, please see a doctor. A doctor should be consulted. According to Goatsby and Ferrari, doctor may ask you questions from the Migraine Disability Assessment Scale questionnaire to assess the severity of your migraine and the effect of the migraine that they're having on you. The doctor may suggest a non-specific migraine treatment, just such as aspirin or non-steroidal anti-inflammatory drugs, or a migraine-specific treatment. Causes of migraines are still not completely known, but studies have shown that many factors can affect migraines. Migraines can have a major impact on your daily routine and life if not treated. Keeping a diary to see what you're eating, avoiding caffeine, and exercising can help you avoid them. If the migraines continue, a doctor should be seen to prescribe you something. A migraine isn't something that should be ignored. Anyone can experience a migraine. And if the right steps are taken, people won't have to suffer from them as much. So guys, who else is going to see a doctor besides me?